Great. Thank you, Mr. Chair, and thank you to our witnesses for joining us again today to share their expertise on PMPBR. We're living in a world where information is easily accessible to everyone and at a time, in any form and anywhere. And as a consequence, there's also that disinformation is easily accessible. It's often said that disinformation will be halfway around the world before the truth has put its shoes on. But many, if not most of us, are not familiar with PMPBR, and I'd like to take today as an opportunity to ask what is fact and what is not, and to elaborate where possible. So with this in mind, could you tell the committee whether the following statement, lower drug prices will lead to a loss of research and development and manufacturing, is that a myth or is that a fact?
There is no empirical evidence to back up that statement, and to the extent that there is empirical evidence, it would suggest a contrary conclusion.
Thank you. And so what are your thoughts on the following statement? Canada's approach is out of step with that of the rest of the world. Is this a myth or a fact, and how does our approach compare to the rest of the world?
It's both a fact and a myth. Like I said, no two regimes are alike, and Canada is the only country with a universal healthcare system that doesn't include prescription drug coverage, and therefore, the idea was we're going to try to approximate what we would be able to secure by way of our monopsony power if we're buying on behalf of the total population by creating a ceiling price regulator. So there is no other country that has a ceiling price regulator in this sector like Canada does, but the new economic factors that we're adopting as part of these regulatory changes are based on pharmacoeconomic value, market size / affordability, are based on best practices internationally. And I'm not aware of any country where these things are not given prominence in the process for determining whether to reimburse a drug and at what price.
Okay, thank you. During these challenging times, something that is on everybody's mind is their job. And is the statement that some drug manufacturers may be forced to cut jobs in Canada, is that a myth or a fact? And could you elaborate on that, please?
I can't speak for it. I think that question should be directed at the companies. I know there's been a lot of attrition in pharmaceutical industry footprint in Canada in the last 10 or 15 years ago. I believe the Prime Minister spoke to that in question period a few days ago. Whether this will exacerbate that, I mean, it's not for me to say.
Okay, it sounds to me like the major differentiator is the fact that we're lacking significantly in homegrown manufacturing.
I think that's my personal sort of take on the situation, and well, I shouldn't say that. It's more than personal. I mean, the data supports that conclusion that companies tend to focus their R&D efforts, resources, investment around in proximity to their international headquarters.
Okay, thank you. Many of our international partners have updated the rules to constrain rising drug prices from many years ago. The new PMPBR guidelines appear to be quite similar or drawn directly from those that are already in place in other countries, including those with large pharmaceutical industries such as the United Kingdom, France, Japan, and Australia. Considering this, would you identify some of the challenges that PMPBR has faced in fulfilling its mandate of protecting Canadians from excessive pharmaceutical prices over the years, and how will these new guidelines help address some of these challenges?
Wow. I mean, I think we've got a number of sort of motherhood seminal policy documents out there that I think I would refer you to. I mean, that's a big question with a long answer. I think, the document that I would refer you to first and foremost is our 2015-18 strategic plan, where it really sets out exactly what you're talking about in writing and in a way that I hope is accessible to most people. But I think, this, just going back again to Dr. Levine's opening remarks, it's just that it's the dramatic shift that we've seen in the nature of the products that are dominating the market. So from small molecule drugs that treat common ailments and that are arguably within the means of ordinary people to complex biologic drugs that treat more rare diseases that are clearly not within the means of anybody, and even institutional payers struggle with. That's one big change. It's necessitated a corresponding change to our regime. And the other big change is Canada sort of pioneered this practice of international reference pricing as a way to ensure that we were getting a reasonable and fair price. But since doing that in the late 80s through the creation of PMPRB, most other countries have copied that. And one of the ways that industry has responded to try to make that a less effective policy is by negotiating confidential rebates and discounts off the public list price. So that's driven pricing underground, and that's proved to be another big challenge for us. And so the changes that have been made to the regulations and the guidelines go directly to the heart of those changes. I mean, the new regulatory tools, the economic tools, pharmacoeconomic value and market size will enable us to ensure that Canadians are getting value for their money for these products that have, nosebleed price tags. And one of the other changes that is currently before the Federal Court of Appeal requires patentees to provide us with the information on those confidential discounts and rebates so that we can regulate the true price in the market. And so that's that's a long-winded answer, but if you want more information, I'd really encourage you to go to our website, because we've been very transparent over the last 5 years about what the problem is, what our proposed solution is, and the path for getting there.
Great. Thank you.
Thank you, Mr. Van Bynen.
Thank you.